Let me know when we can get started. Okay. So good afternoon and welcome to Bill Hearings for the House Health and Government Operations Committee. I'm your chairman, Jocelyn Pena-Melnick, joined by my vice chair, Bonnie Collison. This is our first session back in person since 2020, so I ask for your patience if we encounter any technical streaming issues. Please set your electronic devices to vibrate and don't hold conversations in the committee while testimony is happening. If you need to do so, please be kind and go outside. As a reminder, there's no food or drinks allowed in the gallery because then my wonderful staff they have to clean it, and that's not their job. All bills that are Senate cross files of previously heard House bills will be sponsor only. And the committee will accept oral testimony on Senate bills from the bill sponsor, a sponsor's designee, or the representative of the department that requested the legislation. For Senate bills that do not have a cross-file, we will hear from the bill sponsor, one witness in favor of the bill and one witness opposed to the bill. The public may submit written testimony to indicate their position for the bill. We read every testimony that is submitted in writing, and we give it the same weight as the testimony that we hear orally. For our wonderful subcommittee, and I have the best members, of course I'm biased, please adhere to the one question and one answer, and please keep your questions brief. Members of the public will be able to view the live stream of this hearing on the Maryland General Assembly website or YouTube. And today we will hear the bills in the following order. First, we'll start with Senate Bill 798, Senator Ferguson, President Ferguson. Then we're going to go to Senate Bill 154, Senate Bill 581, Senate Bill 255, Senate Bill 299, Senate Bill 560, Senate Bill 404, Senate Bill 460, Senate Bill 608, Senate Bill 511, Senate Bill 794, and we will end with Senate Bill Senate Bill 622. But Senator Zucker has to be somewhere at 1:30, so if he comes in, I am going to call him after President Ferguson. We also have Senate Bill 626, Senate Bill 644, Senate Bill 558, Senate Bill 584, and Senate Bill 732. President Ferguson, we're moving your bills, okay? So anyway, welcome to our committee, and this is the Declaration of Rights, Right to Reproductive Freedom. It is a pleasure to have you in our committee. Good afternoon.
Well, thank you, Madam Chair, and thank you to the members of the Health and Government Operations Committee. It is a pleasure to be here, especially to my wonderful delegate, who is doing amazing work over here, and of course in our 46th district generally overall. So I'm pleased that you all are able to experience her excellence as I do throughout the district every day. So, thank you all for hearing us today. This is an issue that you all know very well. This is an issue that certainly the Speaker was a leader on last year and this year as well. And things changed in June of 2022. The world changed very quickly in a way, from my perspective, in a pretty demoralizing and unfortunate way, where 50 years of Supreme Court precedent of what we thought was the interpretation of our Constitution, our country's Constitution, was usurped after 9 individuals, but 6 individuals in particular, changed what we knew to be a fundamental right. And so why we are here today is to inscribe that important right, that we in Maryland trust women, we trust bodily autonomy, we believe that people have the ability to make their own choices over their own health care in the privacy between them and their health care provider. And so fundamentally, that is what this bill is about, to put a constitutional amendment in to say that here in Maryland, we protect the right to choose, the right to privacy, the right to liberty, to be able to have that independence over one's own body. And we want to give Maryland voters the opportunity to inscribe that right in the 2024 election. And so that is what the bill in front of you does. I thank you for your time and attention on this. I know that you all have heard a great deal and have had lots of debate already, so I won't extend it beyond where we are, but I think that this is an incredibly important initiative, and I thank you for your time and attention and would urge a favorable report at your deemed appropriate time.
Thank you so much for your testimony. And it's my understanding that it's in the same posture as the House bill, correct?
Yes, ma'am.
Right. Are there any questions for the President of the Senate? Seeing none, thank you for your amazing testimony.
Thank you.
We appreciate it, and
Likewise.
for your leadership.
Likewise. And we're moving the House bills too. I think we had 30 on the floor today, so
Wonderful.
off they go.
Wonderful. You have a blessed day. Thank you so
Likewise.
much. This concludes the bill hearing on Senate Bill 798. Next, we're going to go to Senate Bill 581 first because there's actually no witnesses there, okay? Thank you. Good afternoon, and this is Behavioral Health Care Coordination Value-Based Purchasing Pilot Program. Senator
it is.
Klausmeyer, how are you?
It's good. This is another amazing bill, I tell you. You all love it. But Senator Klausmeyer here, Chair Peña-Mellick and Vice Chair Cullison, and members of the Health and Government Operations Committee, I appreciate the opportunity to present Senate Bill 581. While Senate Bill 581 does not have a direct House cross-file, the exact language of this bill has already been passed by this committee as part of House Bill 1148, the Behavioral Health Model for Maryland. As a brief reminder of the bill, Senate Bill 581 will create a 3-year pilot program involving at least 500 individuals whose behavioral health condition places them at risk of emergency department utilization or inpatient psychiatric hospitalization. Chosen providers would be paid a per member per month fee to provide intensive care coordination for these individuals. After the first year, the full payment of these fees would be contingent on the provider meeting certain outcomes and measures. Creating a value-based purchasing pilot program will help modernize Maryland's behavioral health care system to get better outcomes for those in need. And I thank you for your time, and I ask for a favorable report.
Thank you, Senator. And for our committee, this bill does not have a cross-file, but it's the exact language that we have
Right.
in House Bill 1148, which is the exact language as well. Are there any questions for the senator? Thank you, Senator, for your wonderful
Do you have a
testimony.
question? Oh, you're just waiting.
No, no. They don't, would
All
you
right,
like a
thank you.
question? No, just kidding.
Thank you.
You have a blessed day. Thank you
Okay,
so much.
You have a blessed day, too.
You too, thank you. This
Thank you.
actually
Thank you
concludes
all.
the bill hearing on Senate Bill 581, and I'm going to call Senator Zucker, because I did say at the beginning that as soon as you came, I know you have to be somewhere at 1:30, I will call you. So this is Senate Bill 622, Medicaid Waiver Program, Wait List and Registry Reduction and the Wait Act.
Thank you very much, Madam Chair. For the record, Senator Craig Zucker here to support Senate Bill 622 and House Bill 1149, Madam Chair, which is your exact cross-file on this. I just want to take a moment to thank you, Madam Chair, for all your efforts on this legislation, and I would ask for a favorable report on both bills.
Wonderful testimony. Are there any questions for this amazing senator here? Seeing none, and I know you're Delegate Kaiser's favorite here.
And she's my favorite, Madam Chair. She's my
Yeah.
favorite.
Well, you have a blessed day. And this actually concludes the bill hearing on Senate Bill 622. And now we're going to go to the very patient, very flexible Senator Vital, Senate Bill 154, Public Health, Mental Health Advanced Directives, Awareness, and Statewide Database.
Thank you,
Go
Madam
ahead.
Chair. I do have one.
I know you
proponent.
have one witness that's going to speak in favor, and there's also one witness opposed. So would you like to bring the witness that is going to speak in favor
I
with
would.
you?
I
Why
would.
don't you do that?
Mr. Dan Martin, I think. I'll start, Madam Chair. I know you all are on a tight schedule, so.
Thank you.
Thank you. Senate Bill 154, Madam Chair, Madam Vice Chair, and members of the committee, for the record, Pam Vital, Anne Arundel County. This bill did not have a cross-file, and I submitted it at the request of Senator Addie Eckert, who's no longer in the Senate. But it's an important issue because last year we passed a bill that required advanced directives and easy access for advanced directives, but this bill really narrows down to mental health advanced directives. So it's particularly important when you have young people who, when they're in a good frame of mind, are very willing to have parents, for instance, help them with their behavioral health issues, but it isn't always easy to find those directives, those mental health advanced directives. So this bill requires that the Behavioral Health Administration and the Maryland Health Care Commission to jointly study how first responders and behavioral health crisis providers can access an advanced directive database when responding to a behavioral health crisis. It was previously filed as Senate Bill 994 in 2022 by Senator Eckert and hope that it will pass. It did pass the Senate this year, 45-0, and I respectfully request a favorable report on Senate Bill 154. Thank you.
Thank you. Dan?
Good afternoon, Madam Chair, members of the committee. My name is Dan Rabbit. I'm with the Behavioral Health System Baltimore. We're the local behavioral health authority in Baltimore City and engaged in some additional work to establish a regional crisis system in the greater Baltimore area. Thanks for the opportunity to testify in support of SB 154. This bill, as amended, has two parts, both of which are designed to increase the likelihood that people avail themselves of mental health advance directives and that first responders can access those advance directives during a crisis. The first part would be to have a public awareness campaign so that people who are living with mental health challenges are aware that these tools are out there so that they can share advance directives on how they would like to receive care in the event that they have a mental health crisis. The second part is to study how these advance directives can be accessed by first responders like EMS, law enforcement, or behavioral health crisis providers. These advance directives are really effective at building rapport with people, being empowered so that you can say what hospital you like to go to, what medications work for you, what medications don't work for you, and make sure that your wishes are attended to if you find yourself in a crisis and unable to direct your own care. But they only work as well as the first responders are able to access them. And that's something that hasn't quite been worked out about how and when first responders would be able to access these documents. So we think it makes sense to take a closer look at this. It's our understanding that the Maryland Healthcare Commission is in support, or at least neutral, in terms of looking at how to make these available, and we urge your favorable report.
Okay, thank you. Are there any questions for these two witnesses? I was looking at, since it doesn't have a cross file, and you're here already, I was looking at page 4 of the fiscal note, and it says that the Department of Public Safety and Correctional Services had some concerns about their operational impact. Have you spoken to them at all?
Madam Chair, was that before the amendment? Because we worked really closely with them through the amendment process. Do you know if that's an amended fiscal note?
I don't know if it's before or after. Do you know if they're on board now?
My understanding is they are, but I can go
Okay.
back and double check that.
Yeah, we'll check as
Okay,
well.
you'll check,
Thank
okay.
you. Just want to make sure we check.
Because we worked very closely with them
Okay.
on the amended bill.
Wonderful. So, yeah. That's the first. Yes, yeah. So we'll check.
Okay, thank you very much,
Thank
Madam
you.
Chair.
Are there any questions? Seeing none, thank you very much for your testimony. We really appreciate your leadership, Senator. This actually concludes the bill hearing on Senate Bill 154.
Thank you, Madam
Thank you
Chair,
so
and I
much.
appreciate you.
My
Thank
pleasure.
you.
Thank you. So next, we have Senate Bill 255, which is Senator Hester, Public Health, Home and Community-Based Services for Children and Youth. And this is jointly assigned with appropriations. And we have a member of the Appropriation Committees. Will you please identify yourself?
Delegate Alethea McCaskill.
Thank you, and welcome. And if you have any questions, please let me know, Delegate. You can sit up front. Thank you. Good afternoon, Senator. How are you?
I'm well. How are you, Madam Chair?
We're doing well. Thank you for asking, and
It's
welcome to our committee.
Thank you very much, Madam Chair, members of the committee. For the record, Senator Katie Fry Hester, pleased to represent Howard and Montgomery counties. Here to ask for your favorable consideration of SB 255. This legislation is identical to HB 322, sponsored by Delegate Bagnall, which the committee heard and reported favorably on earlier this month. It's supported by a wide coalition of mental and behavioral health advocacy organizations, and both HB 322 and 255 passed their respective chambers unanimously. So for these reasons, I request a favorable report.
Thank you for your testimony. Are there any questions from anyone? Our wonderful member from Appropriations included. Thank you very much for your testimony. We appreciate your leadership. This
Thank you very
actually
much.
concludes the bill hearing on Senate Bill 255. I want to thank our colleague for being here with us. That was very fast. Okay, now we have, if I may, Senate Bill 299. Is Senator Kramer here? Okay, well, let's go to Senate Bill 560. Senator Guzzoni, anyone? Okay. And this is animal testing and research, human relevant research funding, and animal testing and research contributions. And this is jointly assigned with Health and Government Operations and Ways and Means. Go ahead.
Madam Chair, hi, my name is Eric Galley. It's not Senator Guy Gazzoni, as you probably already knew. He said I could play him for a couple minutes. These two bills are in the exact same posture. There is just one amendment. There's just a typo, and I think staff has that amendment. They're shaking their heads. We're changing one fee was missed, so we're changing one fee to contribution. Otherwise, the bills are in the exact same posture, so unless there are any other questions, we would just urge you to pass this bill with that one little amendment.
Wonderful. Are there any questions for Senate Bill 560? Seeing none, thank you very much for your
Thank you.
testimony today. This actually concludes the bill hearing on Senate Bill 560. Next, we're going to go to Senate Bill 404, Senator Hershey, Hospitals Financial Assistance Medical Reimbursement Process. Good afternoon, Senator. How are you?
Good afternoon, Madam Chair. I'm doing great. Thank you.
Wonderful.
For the record, Senator Steve Hershey to present Senate Bill 404, which provides a reimbursement process for patients that were overcharged or wrongly charged for healthcare services in hospitals. This bill is in the same posture as HB 333, which passed unanimously from this committee and the House floor. I ask for favorable consideration.
Thank you, Senator, for your testimony and for your work. We appreciate it. Are there any questions for the Senator? Seeing none, thank you very much
Thank you
for
very
being
much,
with
Madam
us
Chair.
today. We appreciate it. This actually concludes the bill hearing on Senate Bill 404. We're going to go to Senate Bill 460, Senator Washington. Is she here? Anyone for that bill? All right, how about Senate Bill 511? Anyone here for that bill? Senator Ellis? Thank you. So that is Senate Bill 511, Health and Human Services Transportation Improvement Act of 2023. And if you know if the bill is in the same posture, please let us know. Thank you.
Thank you, Madam Chair, members of the...
Good afternoon.
Good afternoon to you and committee members. Senator Ellis presented Senate Bill 511. And direct answer to your question is in the exact same posture as the House bill which passed this body. I verified with counsel before I came over. Remember the last question I was asked. And I always try to be prepared. So
We appreciate
thank you so much. This bill is amended, establishes a state coordinating committee for health and human services, transportation in the Maryland Department of Transportation. The committee will examine transportation needs of state residents who are elderly, have a disability, or require transportation access to jobs, health-related appointments, senior citizen programs, or other programs requiring the transportation of individuals who qualify as transportation disadvantaged. This bill includes a unique feature to help those who do reverse commute. And when I presented this bill on the Senate floor, I felt I had to basically explain what a reverse commute is. Reverse commute is if you live in an urban area and you have a regular job in a suburban area and you have to go in a reverse normal flow of commute. Usually in Charles County, we look at folks leave Charles County, go into D.C., Washington, D.C. for jobs. The commuter buses line up in the morning to take them there in Washington. But those folks who live in Washington, D.C., there is no convenience for them to do a reverse commute to get to work in Charles County if they live in Washington, D.C. on a regular basis. So that's reverse commute, and this bill will take care of that for folks who live in urban areas, whether it's Baltimore City or any inner Beltway area. We'll work on them being able to have access to jobs in the suburbs. So that's the bill in essence. I move the amendments and the adoption of the favorable committee report.
Thank you very much, Senator, for your wonderful testimony. Are there any questions for Senator Ellis? Seeing none, Senator Ellis, thank you for being here with us. We really appreciate your testimony. Yeah. And I hope you have a blessed day. This actually will conclude the Senate bill hearing.
Thank you, Madam Chair.
My pleasure. On Senate Bill 511. Then we have Senator Carroza. Is she here? If she's not, we're going to go to Senator Lamb. Senate Bill 626, Health Services Cost Review Commission members' appointment Good afternoon, Senator. How are you?
Good. Good afternoon, Madam Chair, members of the committee. Pleased to be here to present Senate Bill 626. This concerns the Health Services Cost Review Commission. Maryland, as this committee I'm sure is aware of, has a very unique hospital reimbursement and rate-setting system, and core to that is the HSCRC, the Health Services Cost Review Commission. The commission has broad authority over assessing fees on healthcare facilities and setting rates for hospitals, and although the work of the commission has been integral to the cost containment that Maryland has seen compared to other states, the commission does have significant influence on the healthcare market in Maryland by nature of its ability to set reimbursement for private healthcare facilities. And it is significant. It's to the tune of about $13 billion a year that is under the purview of this commission and how they set rates and in their negotiations with the Federal Center for Medicare and Medicaid Services agency as well. Currently, the commissioners are appointed by the governor without Senate confirmation, although historically the commissioners have taken their job very seriously. Adding Senate confirmation is just a double check to the process that would reflect the importance of the commission and the level of authority that they have over the state's healthcare system. The Senate currently confirms gubernatorial appointments for other boards, some that have significantly less authority than the HSCRC. This includes boards like the Maryland Healthcare Commission, the Maryland Community Health Resources Commission. All of those members of their commissions are actually Senate confirmed, but the HSCRC members are not. There was also at least one period where the HSCRC had difficulty maintaining a quorum because multiple members were from the same hospital system and had to be recused. Senate confirmation would simply serve as a double check to ensure that the commission is balanced. And final Senate confirmation would make this commission more similar to those other commissions that I mentioned earlier as well. So this bill simply requires the members of the HSCRC to come before executive nominations in the Senate for advice and consent. I have reached out to the HSCRC, and they have confirmed that they have no objection to the bill. I think in your bill packet is also a letter of support from the Maryland Hospital Association. With that, that's the bill.
Wonderful. Thank you very much for the great testimony and for reaching out to the commission. Are there any questions for the senator? Seeing none, thank you, Senator, for your testimony. This actually concludes the bill hearing on Senate Bill 626. Let's go back to Senator Washington, Senate Bill 460. And you have also Senate Bill 608. Let's start with Senate Bill 460, which is the Maryland Medical Assistance Program Gender Affirming Treatment of Trans Health Equity Act. Good afternoon, Senator. How are you?
I'm great, thank you. 4 bill hearings today, so, yeah, at least. Hello. It's good to be here with you again.
It's nice to have you.
Are we starting with 4?
Let's start with 460.
Okay, great.
Thank you.
Good afternoon, colleagues. As you know, Senate Bill 468 is the cross-file of a bill that you've passed out of this committee that addresses a critical gap in our health care for transgendered Marylanders. It ensures medically necessary gender-affirming procedures and services that are covered by Medicaid. We know that gender-affirming care is medically necessary. We know that that's been demonstrated by peer-reviewed research, by physical and behavioral health care providers, as well as advocacy organizations. This legislation, colleagues, when it becomes law, will ensure that the Maryland Medicaid coverage that doesn't currently guarantee to cover gender-affirming care will do so, and it will join 26 states, 1 territory, and D.C., and to ensure once and for all that we do not exclude healthcare-related care to individuals transitioning. Madam Chair, this committee and the Senate, of course, we passed this legislation last year. It has been amended and is supported by a coalition. The bill that's before you is in the same posture of the bill that is in that passed out of this committee and passed the floor. I look for your favorable support of this legislation, and I look forward to answering any questions you might have.
Thank you for your testimony and for your work on this bill. Thank you for leading. Are there any questions for the senator? Yes, Delegate Morgan.
Thank you, Madam Chair. We've debated this bill quite a bit on the House version, and we had a a hearing, a bunch of subcommittee hearings, a long voting session, I think 2 days on the floor, and when we finally got a Attorney General's opinion that was made the rounds via email from a constituent. So this bill does apply to minors, and that's the major change in the law with this bill. My question is, that we have this term in the bill, medical necessary. And what triggers medical necessary?
That is triggered by the healthcare provider.
What?
Medically necessary is a decision that your doctor, your healthcare provider determines after, observation, examination, what is medically necessary to complete the transition in this case, and what is medically, that's a simple answer, that it's the decision between you and your healthcare provider.
But you could have medical necessary on the one thing is always, that I always wondered about this bill, it says gender affirming care. Mm-hmm. So if someone of the same sex wanted the same treatment, mm-hmm. that wouldn't be medical necessary, correct?
Well, it's my understanding, again, I'm not a doctor, but there are a number of different treatments and there are a number of different diagnoses and that necessitate care. So it really depends on the case. So it would not be appropriate to compare someone who's not seeking gender affirming care's request for a particular operation or procedure and someone who is under medical care and is in the process of seeking medical care or treatment.
Thank you. You're welcome. I have Delegate Kaiser.
Thank you, Madam Chair. I want to follow up on Delegate Morgan's question. He's asking a question outside the scope of this bill. Isn't that so?
I think I would say it is so, and it is so in that in many things, the question about what is deemed medically necessary is between a patient and their healthcare provider.
Thank you.
Thank you. Seeing no other questions, thank you very much for your testimony on this bill. And why don't we go on to actually seeing all the questions. This actually concludes the bill hearing on Senate Bill 460. Let's move on to Senate Bill 608, Human Services Maryland Statewide Independent Living Council.
Thank you. Mm-hmm. Hello, everyone. I didn't know about this council until, again, my new delegate, Delegate Forbes, asked me to be the cross-file of this bill, and I believe you have passed HB 53 out. This bill is in the same posture, and it is to make amendments in the law that created the Statewide Independent Living Council, and it was created in 1993 under executive order. And this bill enables the Maryland Statewide Independent Council to form a nonprofit, to have much more autonomy, to have the autonomy in all matters of their business and programming that was originally really contemplated under the federal law. So the amendments to SB 680 that you should have before you, there are a few amendments that make it different. One, it substitutes the language Centers for Independent Living and has it designated as designated state entity. And it updates older standards that designated the Division of Rehabilitation Services as the designated state entity. Also, Centers for Independent Living, they are a community-based organizations. They're designed and operated by people who are living with disabilities, and we, again, are allowing them to continue this work to improve the conditions of their communities. The other major amendment removes the provision for the Board of Directors for the Maryland State Independent Living Council, and instead, the council is going to function independently. I look forward to your favorable report and here to answer any questions.
Thank you. Are there any questions for the senator? Seeing none, this actually concludes the bill hearing on Senate Bill 608. Thank you for your wonderful testimony. Have a blessed day.
You too.
Next, we're going to go back to, is there anyone here for Senator Kramer? All right, why don't we go on to the next person on the list, which is Senator Carrozza, Senate Bill 794.
Good afternoon, Madam Chair,
Good afternoon.
Vice Chair, and members of this distinguished committee. For the record, Senator Mary Beth Carrozza, a proud former delegate and now representing Worcester, Wycomico, and Somerset counties. And I want to first just very briefly thank the leadership of this committee, both the chair and the vice chair over the years for guidance, and specifically want to thank the chair for recognizing the importance of these financial challenges that the trauma centers in Maryland have been facing, and especially guidance with Tidal Health. So thank you for that. Today I'm here to present the Senate Bill 794. This is the cross-file of this is House Bill 1153 that received a unanimous vote from the full House on March 13th. And I also want to thank Delegate Chris Adams for his leadership on the bill. This bill would allow the Maryland Department of Health to adopt a regulation standards that are appropriate to residential treatment programs for substance use disorder that have under 17 beds. In practice, this would allow residential treatment programs for substance use disorder to not have to install an elaborate and expensive commercial kitchen like you would see in a larger industrial setting. Both the Senate bill and the House bill were amended to address the concerns of the Maryland Department of Health and the Maryland Association of County Health Officers. And I do want to thank the Maryland Department of Health for working with us on this bill. As many of the members here know, the cost of a commercial kitchen in a residential home that houses one of these programs could be skyrocketing. In some cases, an existing kitchen would have to be gutted and replaced with a commercial kitchen appliances, such as commercial sinks, ventilation hoods. In some instances, the commercial kitchen would require more space than the original residential kitchen, and this space may not be available. And in many cases, requiring a commercial kitchen would severely disrupt the current program, and just impacting the comfort and supportive atmosphere of a small home that these small programs offered, and would be, again, very cost prohibitive for these programs. And also want to point out, as many of the members here know, these programs are designed for individuals to set them up for success after they leave these homes. So including the cooking in a more typical residential kitchen would be most appropriate. So appreciate, Madam Chair, Vice Chair, and members for hearing me out. And I ask for favorable and swift consideration of Senate Bill 794.
Thank you, Senator, for your testimony. And Delegate Hutchinson is doing a great job on that bill, on the title care.
I am so glad to see him take the lead on this and with your guidance, and it's really been a team effort. Thank you, Madam
My
Chair.
pleasure. Are there any questions on Senate Bill 794? Seeing none, thank you, Senator, for your testimony. Hope you have a great day.
Thank you, Madam Chair.
My pleasure. This concludes the Senate bill hearing on Senate Bill 794. Next, we're going to go, is there anyone here for Senator McCray? How about Senator Gazzoni, Senate Bill 558? Mr. Pica, you want to come up?
Senate Bill 558.
558, yes, that's correct.
Is that okay?
Yes. Welcome and good afternoon.
Thank you, Madam Chair. John Pica on behalf of Senator Gazzoni. This is a companion bill to House Bill 681. It's been amended in the Senate. The amendments are the result of collaboration and negotiation with advocates and the Maryland Department of Health. This bill establishes a $500,000 funding program for certified levels 1, 2, or 3 recovery residences. It will be administered by the Department of Health, and the appropriation is mandated through fiscal year 2027. That's all I have, Madam Chair. I'm certainly open to questions.
Are there any questions for Mr. Pica? Seeing none, thank you very much for your testimony today. Let him know you did a great job, and this concludes the Senate bill hearing on Senate
Thank
Bill
you, Madam Chair.
558. My pleasure.
A long time ago.
We have a sense of humor. Anyway, next we have, is there anyone here for Senator McCray? All right, how about Senator Guile? Good afternoon. This is actually Senate Bill 584, Public Health Parkinson's Disease Advisory Committee and website. Good afternoon. How are you?
Good. Madam Chair, Madam Vice Chair, and members of the Health and Government Operations Committee, my name is Spencer Dixon, and I am Senator Giles' Legislative Director here to present SB 584 on her behalf. As you know, this bill was cross-filed with HB 703, which was heard in HGO on February 28th, but never voted on. This morning, the Public Health and Minority Health Disparities Subcommittee heard the Senate bill as amended and amended HB 703 to be in the same posture as SB 584 with a small additional amendment. This bill, as amended, responds to concerns of stakeholders, is scaled back from its original version, and thus has a significantly reduced fiscal impact, as you can see in the revised fiscal note, which projects the bill will cost about $105,000 on average over the next 5 years. This bill, as amended, requires the Parkinson's Disease Registry Advisory Committee that the Maryland General Assembly created last year to 1, consult with stakeholders to collect data and work with the CDC to aid in creating a national Parkinson's disease registry. 2, beginning July 1st, 2023, meet at least quarterly. 3, by October 1st, 2023, the MDH, in collaboration with CRISP, must establish a website that includes information on Parkinson's disease in the state by age, gender, sex, race, ethnicity, and county. And this website must be updated annually by January 1st. And 4, finally, by December 1st, 2023, submit a report to the Senate Finance Committee and HGO on recommendations for a path forward towards establishing a fully functioning state Parkinson's disease registry. As you can see, the Michael J. Fox Foundation submitted a letter of support, and MDH submitted a letter of support with an amendment that was adopted by the subcommittee. I'm happy to answer any questions you may have and respectfully urge a favorable report on SB 584 and HB 703.
Thank you for your testimony. Are there any questions for Senate Bill 584? Seeing none, thank you very much for giving us your testimony today, and give our regards to the senator.
Will do. Thank you.
My pleasure. This actually concludes the Senate bill hearing on Senate Bill 584. We're going to go to Senate Bill 732, and we have two people here. We have Ken McKay and we have Carol Beatty, Secretary of the Maryland Department of Disabilities. How are you?
Thank you.
And good afternoon.
Good afternoon.
This is the Senate Bill 732, Department of Disabilities, State Coordinator for Autism Strategy and Maryland Commission on Disabilities alterations. How are you?
I'm good. Thank you very much, Madam Chair, Madam Vice Chair, and members of the committee. For the record, my name is Carol Beatty. I am the Secretary for the Maryland Department of Disabilities. And with me today is Kim McKay. She's our Communications Director, and she's here to help answer any questions if we had some.
Thank you.
Thank you for this opportunity to testify in support of Senate Bill 732 with amendments. This bill will amend the membership of the Maryland Commission on Disabilities by adding a member of the traumatic brain injury community to its membership. The Commission on Disabilities advises our department on its duties as the principal unit of state government that's focused on developing disability policy and the development of best practices for our state. It's made up of governor-appointed representatives from many major disability groups, but currently we do not have a representative from the traumatic brain injury community. And we felt like it was time do that and to change this situation. There are more than 605,000 people with brain injury in our state. And we also feel that it's best when the person is one with lived experience so that they can share with us their experiences, need for change, and advise the department on ways to do that and to address the needs in their community. This bill also, as amended, moves the statewide coordinator for autism strategy and the advisory stakeholder group on autism-related needs from the governor's coordinating offices to our department. The coordinator and the advisory stakeholders group work, we believe, will be best supported and enhanced by the deep subject matter expertise that our policy team can provide. Our department, I think it's important to note, is not organized by specific disability types, and this position will be something of an outlier within our department. However, as an active participant in the work of the advisory stakeholder group over this past year, I believe that this move will bring vital and to date missing resources to their work. I look forward to working in partnership with the staff and the autism stakeholder group to make this transition successful. So I'm urging the committee's approval of Senate Bill 732 with these amendments, and we're happy to take any questions.
Thank you very much, Madam Secretary, for your work. Are there any questions for the Secretary? Delegate Alston.
Oh, thank you, Madam Chair. I'm looking at the membership of the board. It looks like it'll be approximately 24 members with the addition. Are there any concerns about the board being in deadlock with an even number of members?
To be quite honest, we work collegially together, and we don't usually take votes that will be of controversy. Usually there's a lot of discussion and an agreement before any votes are taken. So I don't foresee any problems.
Okay, thank you.
Thank you.
Any other questions? Seeing none, thank you so much for being with us today. We really appreciate your work and your testimony.
Thank you so much.
My pleasure. Have a blessed day. This actually concludes the bill hearing on Senate Bill 732. Next, we're going to go to Senate Bill 644. Senator McCray. Good afternoon, Senator. How are you?
It's great to see you again, Madam Chair.
Thank you. They said your colleague, Senator Benson, likes to say, it's nice to be seen of you.
It's nice to be seen
That's
of you.
what she always says. You could tell her that I channel her today.
Yep. Thank you again, Madam Chair. Thank you, Madam Vice Chair. For the record, Corey McCray, Senator for the 45th Legislative District. And I come to you in reference to Senate Bill 644, House Bill 876, Maternal Mortality Review Program. This is a bill that my local health department looked to put in reference to addressing maternal mortality. This is already done in some fashion or form for older ages from that standpoint. But they were looking to drop down and move in that direction. Madam Chair, I usually don't spend that much time on bills that have already passed your committee, but I do know that there was testimony that I believe my city has a disagreement with in reference to the wording. So I think that MHA had put in a letter favorable with amendment to where it addressed immediate from that standpoint. And the city's standpoint on that is that this is the same language that they had utilized in other information that they do the research on. So they kind of modeled that right off of the information that already exists for this one, and they would like to keep it in the posture that it has happened. I got the information from MHA, I believe, either yesterday afternoon, or this morning. So I haven't had the ability to have a conversation with my city. Just immediately emailed me about a couple hours ago to say we would like it in the posture that it did pass in the House and the Senate.
Okay, all right. Wonderful. Just keep us posted.
Yes, ma'am.
Okay, so that we can act on it.
Yes, ma'am.
As well. Are there any questions for the senator? Seeing none, thank you for the clarification and thank you for your work. It's an important issue.
Thank you again.
You have a blessed day.
Y'all have a blessed day, too.
Thank you. Okay, this concludes the bill hearing on Senate Bill 644. And we're going to go to Senator Kramer's bill He is actually testifying in another committee. Why don't we have someone that is here from his group to testify? Do you feel comfortable, or do you want us to wait? You want us to wait? Okay. And this is the last bill. So, do we know how long he's going to be in ECM, anyone? Okay, all right, so this is the last bill. And I know that we are actually working on something, right? Delegate Collison, and for the record, this is, let's just do this. This is Senate Bill 299, which is the last bill that we have today. And I know that I had a meeting with the vice chair and some members of the community and advocates. So Senator Collison, can you give us an update? Delegate Collison.
No, I don't want that, Madam Speaker. Oh. We do have a sense of humor.
Go ahead.
So, thank you, Madam Chair, for the opportunity. I am the cross-file, I have the cross-file bill for Senator Kramer's bill, SB 299. And I want to add on to what the chair has said. The advocates for the restaurants and the retailers are working with us, and we are, I think that we are close to an agreement on this bill, so I'm hoping that it will, that we are going to get to that spot. I believe that we are going to get to that spot where we can all at least live with the results. What the bill does as it came to us from the Senate is it continues the mandate for restaurants, but it raised the threshold to $1 million. You'll recall that when I came to you, it was $400,000. The Senate raised it to $1 million. And then in the, they also eliminated all of the training that's required under MIMS at this point for CPR and how to use the AEDs. And the rationale for that was that you saw how easily the AED can be used, and in fact, it can't be used incorrectly. So we felt that it would be, that since one of the biggest challenges and barriers for the retailers and the restaurants was having someone on staff constantly that was trained in that machine, was going to be very challenging to them. So that is out of the bill, and I think that right now the retail part deals only with grocery stores. And I'm going to remind you, the question that the advocates continually ask is why us and not everybody else? The answer is we have to start someplace, and everyone eats, or I think everyone eats, and either they go to a restaurant or they buy food. So these are where we can get the most amount of people, where there is the potential for a sudden cardiac event, and we want to be ready when there is. So that's where we are with the bill right now, Madam Chair, and we hope that it will be in subcommittee this week, and we'll have a good product to bring back to the committee.
So the bill is being worked on. We did have a meeting on it. So we're going to put it in subcommittee to try to get a compromise, and we'll come back to you, okay? I think that the senator would have, I think my delegate said it beautifully. So therefore, we're going to rest with her word. Delegate Kaiser, you would like to say something?
Just that the senator asked if his delegate could present, and of course, I told him she already was and that he should pay her.
Okay, beautiful. I love it. So this actually concludes the bill hearing. And I'm going to do something that I usually don't do because you're not signed up, but we represent it correctly, right? Working with the industry. For the record, can you tell us your name?
Thank you very much, Melvin Thompson, representing the Restaurant Association of Maryland. And Delegate Cullison, Vice Chair, ma'am, you are correct. We are continuing to work with you. We submitted some amendment language and hope to continue working on that and come to some agreement at the subcommittee meeting later this week. Thank you.
Beautifully stated. Okay, so this actually concludes the bill hearing. Oh, here he comes. All right, they talked enough. I don't think you have to say much, but your delegate did a fabulous job. Why don't you come up? Yeah, it's been sold already. It's been bought. Go ahead.
Thank you, Madam Chair. My apologies. I was being grilled down in Economic Matters Committee.
Really?
Trying to wrap up. This is a much friendlier looking group of people, I gotta say. What a relief to come over here. No, my thanks to the Vice Chair. I understand while I was sitting at the table in ECM that the Vice Chair was introducing the bill. So, Madam Chair, if there's questions, I'm happy to do my best to answer them, but I don't want to take up committee time unnecessarily.
We appreciate it. So the committee, the bill is going, she presented it beautifully and Melvin spoke. So the bill will be assigned to subcommittee where we're working on a compromise and we should have it for vote this week, okay?
Perfect.
And you're welcome to come to the subcommittee. If you like, you're more than welcome to.
Thank you for
All
that,
right.
Madam Chair. Thank you, committee. It is a very important bill. It's an important policy decision. That's the bottom line. And it's about saving lives. So with that, thank you.
Thank you. So this actually concludes the bill hearing on Senate Bill 299, and have a blessed day.
Thank
and this
you.
This concludes the bill hearings for today. Will you be so kind and stay seated? We're going to vote. Thank you very much. All right. We need a new link? All right, thank you. I want to take a minute to thank staff for getting us here. We're on voting list number 12. Today is Tuesday, March 28th. This is the Health and Government Operations Committee. We have 4 bills that are favorable. We're going to start with Senate Bill 460, and that is Aaron and Delegate Bagnall. Aaron.
This bill is identical to its cross-file, House Bill 283, which passed the House 93 to 37.
Okay, are there any questions for Senate Bill 460? One second. Actually, we're in discussion.
Okay, thank you, Madam Chair. No, the point of discussing this bill is what I said when we just questioned it with Senator Washington. It took us a considerable amount of time to get back to what this bill actually is, and are we in agreement that this bill, the change that it makes is for minors? And then on the second question is, going back to Delegate Kaiser's question, which I thought was appropriate for me to ask during the committee hearing, is if it's medically necessary, how can it be medically necessary to have a necessary Medicaid surgery for, let's say, a scenario of a male transitioning into a woman, but it can't be medically necessary for a woman to have the same type of surgery? And that falls under cosmetic. I would love for somebody to riddle me those two answers. That would be great.
1 second. You know, let me, actually, it's favorable. Let me get a motion and we're in discussion. All right, no, it's okay. It's all right. So the bill has been moved. Is there a second? It's been moved in second and we're in discussion. And I know Delegate Collison wants to be heard, followed by Delegate Hill. Okay?
Thank you, Madam Chair. Thank you, Delegate, for the question. So you know insurance well enough to know that insurance companies get to make decisions about what they pay for and what they don't pay for. And they typically do not pay for things that are truly cosmetic. And they make judgments about what is cosmetic. And I'm talking about they, the insurance companies, make judgments about what is cosmetic. Individuals can appeal when the insurance company makes that determination. And if they have the support of their physician, then, and the physician says, this is medically necessary because here are the reasons why it is medically necessary, then what the insurance company considered to be cosmetic now becomes medically necessary. With respect to transitioning for transgender, that is always going to be under the guidance of the physician determining whether or not it's medically necessary. And for a variety of reasons, and not the least of which, we heard a lot about this in our previous discussions about the impact on mental health and the fact that being able to transition in order to become the person that they they know they are, will support them emotionally and mentally and improve their quality of life going forward. So does that, and if for some reason the insurance company said it was cosmetic, the doctor would have to prove that it was medically necessary. And I would just remind you, currently, the commercial insurance carriers cover the transitioning surgeries as appropriate, as determined to be medically necessary. So what we're doing with this bill is simply asking Medicaid to do the same thing for folks who qualify.
Delegate Hill.
So Delegate Morgan, what the Vice Chair said is essentially the same, and it's not unique to this. So
Delegate Hill, could you put your microphone down a bit? Thank you.
Thank you. So based on, standards of practice, the provider suggests what is medically necessary. The insurance makes a determination about whether they consider that medically necessary. Sometimes they'll say, when pushed, we're not saying it's not necessary, we're just saying we're not going to pay for it. So there are patients in the field, where I am, a breast reduction on one patient, cis female, may be covered as medically necessary, and a breast reduction on another patient, cis female, may not be covered, as they will consider that it doesn't meet certain standards, and they won't consider it medically necessary, okay? A tummy tuck, in certain cases, is considered medically necessary if there's supporting evidence to explain how the condition that it's set to remedy is causing health concerns. And it could be rashes, it could be back pain, it could be another things. So this idea of determining medical necessity is a standard part of how medicine is practiced and what insurers and providers wrangle with every day. It is not unique to this bill. It is not unique to these procedures. It is not unique to gender. But that is one of the factors. So I don't know if that answers your question, but that is indeed how this is done. And procedures that were considered medically necessary some years ago may not now. Okay, so again, another example, there was a time when pinning your ears back was considered medically appropriate and necessary. Okay, generally now insurances don't, even when, like I have a patient who has one ear that's out, and his parents said he kept running into the door because he kept walking through the middle, but this ear was too close to the door frame. So he's traumatizing himself, That's an argument with the insurance company. So I think it's medically necessary because he's traumatizing himself. They may not. So it can range, but medically necessary is not as cleanly defined as you would like, but there are standards of practice that are the guidelines, and those are what providers depend on to determine what they say to a patient, whether they're recommending something as being medically necessary.
Thank you. Thank you for the good conversation and balance. I appreciate it. Delegate Chisholm.
Thank you, Madam Chair. Probably for Vice Chair. So when it comes to private insurance, do they pay for all the procedures that are outlined in this bill for minors? And if so, do we know how many have actually gone through the gender affirming transitional surgeries paid for by private insurers for minors over a given period?
Okay, there we go. Madam Chair, is it okay?
Yes.
Okay. Again, I'm going to go back to whether or not something is medically necessary. They are not going to, commercial insurance carriers are going to just be a part of that decision-making around when it becomes medically necessary. I think that the rule that folks look at generally in terms of what I've heard from the commercial carriers is that they like to wait until the person is 18 or older for actual surgical changes. But in rare instances where the medical provider, the parent, and the patient are all in agreement that at this moment in time, because of whatever circumstances and need that individual has, it's necessary before that age of 18. So they would cover it under those conditions.
Would, but have they? So the commercial carriers are currently performing these type of surgeries on minors, as far as you know?
As far as I know, yes.
But we don't have
In
an
those
idea of
rare-
how many?
In rare occasions. No, I only know that it's rare. That's all. I don't have numbers.
Okay, thank you, Madam Chair. Thank you.
Delegate Riley.
Thank you, Madam Chair. Is it safe to say that the diagnosis of gender dysphoria would be a physician to say, well, it's medically necessary with that particular diagnosis?
Again, it is very individualistic. There could be someone who is diagnosed with gender dysphoria at, let's just say 8 years of age, because of their manifesting different kinds of things. But decisions about what treatments to use are going to be very individual and case by case. So it's really going to, I can't say, that.
But it would qualify in some situations.
I'm sorry, I'm misunderstanding something.
That diagnosis from a physician, gender dysphoria, would qualify for some patients as medically necessary.
Would qualify them potentially for treatments which the physician defines as medically necessary or indicated, yes.
Okay, all right, and Madam Chair, can I have a follow-up?
Sure.
One more question. Another question, I thought I heard it when we were on the floor debating this. So, so we're always concerned because under this bill, even though if it was medically necessary and it would be a minor, you had said that they would still have to have, consent from the parent.
Correct.
So I thought I heard on the floor that there's only one exception to parent consent, and that was for mental health. Wouldn't this fall under mental health?
No, if I said that on the floor, I didn't.
Incorrect.
I was not being correct.
All
No,
right.
the only exceptions would be when the child is emancipated, or I don't think there is an or. I think that's it.
Great.
Yeah.
Thank you for that. Thank you.
Any other questions? And I just want to, just for the record, first I want to say thank you for the discussion. And for the record, just to clarify that gender affirming care is not always surgery. It can be counseling, simple as counseling. So it's not always surgery. And as a matter of fact, many people end up not getting it for many reasons as well. And I just want to thank everyone for a respectful discussion on this bill. The bill has been moved, oh, Delegate Kipke, it's like I didn't even see the light. I apologize.
On this bill, I keep hearing things that hit me as not being the bill. So counseling, hormone therapy, all that is already covered by Medicaid. Am I wrong? The only thing that's not covered under Medicaid is surgery for under 18.
1 second, we'll get
That's-
your answer.
That's not the case. I mean, some of it is covered, but not everything, not the entire range of options, you know.
In regulation, it is.
And the reason this bill is before us is because it's not being delivered.
Okay,
Okay.
thank you.
Thank you for the question. Are there any other questions? This is the time, if you have any other concerns or questions, to get your answers. Okay? Everyone feels that they were heard? Okay. Delegate Hill.
Thank you, Madam Chair. I just think it's really important, perhaps, to try and help folks to understand that healthcare providers, when dealing with patients of any persuasion with any kind of condition where they are making recommendations, as a general rule, it's not as cut and dry as check a box, here's a diagnosis, check a box, here's a treatment. It is what's going on, what are their symptoms, what are their signs, what do the lab tests show you, what has been tried, what has failed, what are the other options, how do you feel, can we send you to someone else, is there something else that can be done, there is a range of things that I'm talking about anything from, you dropped a engine on my hand. I got a lot of options there. Some are good and some are bad. And patients have the opportunity to make those decisions. When we talk about children, the problem to me about making absolute prohibitions is that it is the legislature then stepping in the place of the provider with no information about any individual's situation. So we don't know whether we're talking about, if we're going to start making up, hypotheticals. We don't know if we're talking about a child or a juvenile who was intersex at birth and was therefore assigned to a particular gender, and subsequent testing or subsequent presentation indicated that this caused grief. We don't know if they were a child who had an injury around the time of birth, where, for instance, the testicles got injured. And we certainly know in the 1950s and 60s there had been a standard of practice that if that were the case, if the testicles were lost, since the hormones wouldn't be there, there were places where the standard was to say, assign them female. And they would be assigned female as neonates, given hormones, raised female, and in many cases, come to find out later that that's not who they were. So there are all kinds of extremes, from injuries to accidents to kids with multiple different genitalia, or combined, people with bifid penises, they've got two penises. So if we say no penectomies, then we're just saying it for transgender, but a kid who has two penises can't have the penis taken off until he's 18 years old, the second one, but he can have the additional finger taken off. There are so many variations that somehow it seems to be best to let the professionals who have the training and the patient in front of them, with all the complexities that go into being a patient, who have, if we're talking about juveniles, the parents with all their concerns, who can have a full discussion over time, which could be years, to have the freedom, since we want to give parents so much freedom over their children, to make the decisions, since we can't possibly be in every room and in every consultation and every discussion. And to me, that's essentially what this is about. It's about saying that individuals deserve to be treated like individuals and to be offered treatments that are within the standard of practice, for them to make a decision about whether they want to accept it or not. And that just because one is a child, that should not be denied them. So that in those extraordinarily rare circumstances where a confluence of physiology, nature, hormones, whatever, that we can't even imagine, that that child is not stuck because some legislatures in 2023 didn't have the imagination to come up with a scenario that describes their specific situation. And I just want to get that out. Thank you.
Thank you. Delegate Taveras.
Thank you, thank you. And I just want to thank Delegate Hill for saying that, because I think this may apply to a friend of mine. She was born with both organs, a penis and breast, and she identified as a female. So it, just interestingly enough, married, 2 kids now, but this is something that she had to make a decision what sex she would be. But anyway, my question is, I think that you all have a AG opinion that states something, and I think that it would be fair if we actually got to see it and the posture of the question that was presented to the AG. Thank you. If it could be shared, if possible.
Delegate Taveras, some AG cannot be shared because you can request it.
The opinion that was emailed to several of us, that was submitted via a constituent, I believe, in Anne Arundel County. So it wasn't confidential.
It was not confidential,
So
okay.
I believe Delegate Chisholm has it. We can share it.
Okay. All right, Delegate Shalega.
Thank you, Madam Chair, and I just, for the record, want to let it be known that no one disagrees with the extraordinary situations that Dr. Hill, Delegate Hill, was speaking about. No one. But this bill is not about intersex. This bill is about transgenders, and that's the title of the bill. No one would deny that kind of care to children that you described. I do want to also let everyone, make sure everyone's aware, there's been a lot of discussion about whether this is about minors or not. This bill, if you read it, puts the standard of care medically necessary under a group called WPATH. WPATH SOC 8 removed all age restrictions for puberty blockers, cross-sex hormones, and surgeries. All age restrictions. That organization is neither medical nor legal, but it is an advocacy group and now referred to as such in at least many court proceedings. There have been peer-reviewed studies in the past year assessing international guidelines for strength of evidence. And that's what we're concerned about. Not the unique situations that you spoke of. But those of us that are opposed to this are very concerned about minors and experimental medical procedures being used, including puberty blockers, cross-sex hormones, and surgeries. Thank you.
Thank you, Delegate Shalega, for sharing that. Delegate Collison.
Thank you, Madam Chair. So I just want to be clear about who WPATH is, and I don't know what all the initials stand for. but it is, I'm not sure who's characterizing it as an advocacy group, because it's not an advocacy group. What it is a group of medical and behavioral scientists and social scientists and family community researchers who meet together on a regular basis to discuss the standards of care related to transgender people. And they are the ones who are making recommendations around what the standards of care are to meet the needs of this population in the most effective way for, and in terms of making decisions about medically necessary, in terms about making decisions about which treatments to make, they provide the information that to physicians who are then weighing whether or not a particular treatment is medically necessary and indicated. So this is not an advocacy group in any way. It is simply a group of medical and behavioral health science specialists, physicians, and providers who have taken on the responsibility of doing the research. And the information that they have around puberty blockers and the use of hormones is based on intensive research on their current utilization and the impact. And so they're the body that's gathering information that will help inform the treatment of these individuals.
Thank you. Delegate Chisholm.
Yes, Madam Chair. I will share with what was forwarded to me. So we do not have a letter back from AG. This is not in response to anything we requested from them. This is an email that was sent to me from a constituent that just asked the questions of the Attorney General, who said, the legislation under consideration in Maryland's General Assembly, HB 283, SB 466, or 460, authorizes Medicaid to cover medically necessary gender-affirming care for adults or for minors with parental consent. If passed, the law will not permit medical treatment or procedures that are not medically necessary. And like all medical care in Maryland, gender-affirming care may not be provided without consent of the child's parent or guardian. Furthermore, we have followed the legislation closely and can assure you it does not authorize the mutilation of children in any way. I'm sure that's what she put in her letter. But just because Delegate Tavares asked for it, essentially just says exactly what everybody in here said. If a doctor or provider says that it's medically necessary to do the surgery, then Medicaid would pay for it, but you would need parental consent if you are a minor. So I don't think there's anything controversial. I don't know how she knew we had an Attorney General opinion, but.
Thank you, Delegate Chisholm. So the bill has been moved in second. We're going to take the vote. All those in favor say aye. Aye. Any opposed? I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke for the record. Thank you so much, everyone, for a respectful discussion. I'm not surprised because this is what the committee is, and I'm very grateful to be part of it. So next, we're going to have Senate Bill 534, which is actually Preserve Telehealth Access Act of 2023, and that is Aaron. Actually, Aaron, you're it today.
That's it. This bill does not have a cross-file. However, the provisions of this bill are verbatim in House Bill 1148, which passed the House unanimously.
It's been moved in second. Any discussion or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Can you let me know now? All right, none. Thank you so much. Senate Bill 581, Behavioral Health Care Coordination Value-Based Purchasing Pilot Program. Aaron.
And this is the same situation. It does not have.
It's been moved. Is there a second? It moved in second. Any concerns or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes unanimous. Senate Bill 798, you're on a roll there. It's been moved in second. Any discussion or concerns on Senate Bill 790 and Declaration of
This was
Right,
not unanimous.
Right to Reproductive Freedom? All right. Anyone? All right, seeing none? Oh, what is it?
It was 9937.
9937, okay. All those in favor, say aye. Aye. Any opposition? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Thank you. This actually, the bill passes, and it's not unanimous. All right, so this actually concludes the bill hearing, the voting session on these 4 bills. We're going to be having some bill hearings tomorrow. We're going to be voting, so we'll probably vote often on these bills. You're going to be meeting last minute as well, so I want to thank you for being flexible. And for assignments, is Delegate Gazzoni here? She's not. All right, because she had Senate Bill 534 and 5... Oh, it's okay. It's okay. She has Senate Bill 534 and 581. But thank you for looking out, Michelle. I appreciate it. And we'll give her those bills because she had the behavioral health bill, and the behavioral health bill, 1148, has 5 bills in it. And we're going to be passing them individually and then also in that big bill as well, okay? Anyone has any announcements? Delegate Bagno.
Just a reminder.